Senator Alexander, Senator Murray, Senator Collins, my heart is still in Maine, and members of the committee. Thank you for this opportunity. I am President and CEO of the Pacific Business Group on Health. We are a nonprofit coalition of large public and private purchasers seeking to achieve higher quality and more affordable care on behalf of our employees. It is an honor to be here. This is the right discussion to be having. Thank you for your bipartisan leadership. PBGH members collectively spend over $100 billion annually purchasing health care on behalf of their employees, collectively for over 15 million Americans. Our members are deeply committed to the health and well-being of their employees and buying health care services that promote optimal health. But even the largest private purchasers of health care in the world cannot overcome the current industry consolidation, opacity, anti-competitive practices, and egregious pricing in U.S. health care. It may seem somewhat surprising that an organization representing large private sector companies would seek policy intervention into the market, and it is surprising. My members are committed to private sector market-driven solutions, but in much of U.S. healthcare, the market is simply broken. A functional market does not regularly drive families into bankruptcy. It does not depend on GoFundMe campaigns for treatment costs, and it does not absorb a decade of U.S. wage growth. If the world's largest and most sophisticated companies are challenged to buy high-quality and affordable care, it is simply unfair to expect that of small businesses or families. The dysfunction is so profound that we are seeking your support to make a functional market in the U.S. healthcare system possible, and we believe that this bill goes a long way to achieving that. There are several important points, but three that I want to highlight. There is strong evidence that cost-effective delivery, high-quality care is possible, and it should be expected. Although we prefer market solutions to the problem of high costs, government action is needed. We also support your efforts to control drug pricing, and we would urge you to go even further, and to include provisions that support primary care and mental health. Most importantly, we want to say that it is possible, and we have bold innovations driven by our employer members, most notably Walmart's recent pilots with Centers of Excellence for Specialty Services. This is a program, the Employer Center of Excellence Network, designed by Walmart, administered by PBGH and our TPA, for hip and knee replacements and surgeries. We set high-quality standards, vet and select the best facilities in the country, and support employees to use these. I've provided for your reference a recent Harvard Business Review article on the results of the program, but it is important to highlight patients who participated reported 98% satisfaction and better patient-reported outcomes. Readmission and complication rates were markedly lower. The ESIN program results demonstrate that it is possible to save money by reducing unnecessary services and improving outcomes and patient experience, while highlighting that the practices this bill seeks to address are barriers to widespread adoption of this model. Additionally, we strongly support the elements that would remove gag clauses on the sharing of price and quality information by providers. It's hard to imagine that providers are barred from sharing information about quality and cost with patients. We strongly support the elements of the bill that would ban anti-competitive contracting practices, including anti-tiering, all or nothing, and similar clauses that are used to gain market power and raise prices irregardless of quality or variable performance. We urge Congress to enable Medicare beneficiaries to identify and seek care from high-performing centers in a similar program. We also strongly support the protection of patients from out-of-network deductibles, surprise billing, and we support option 3, a benchmark for payment. We strongly recommend setting payments based on average payments to specialty physicians, i.e. 125% of Medicare rates. While it may be unusual to have us ask for price setting, we believe that this fairly captures the costs. We also think this is the most straightforward, efficient, and transparent approach to regulating these prices. A second best solution would be the use of payments based on median contracted payment rates, although we are concerned that the resulting benchmarks under this method would reflect prices that are already too high. We strongly also recommend that the definition of services in surprise billing be expanded to include ground and air ambulance services. We are pleased that you have acknowledged this as a problem, and we understand that states are limited in addressing this problem due to federal jurisdictional authority, and it is up to Congress to fix this directly. We strongly support all of the transparency initiatives, including the establishment of an all-payer claims database, but would urge you to consider complete data access, including pricing and allowed amounts, for the greatest utility of this database. We would ask that physicians and patients have key roles in the governance of such a database, and that these data sets are mutually accessible and coordinated with regional state databases. We look forward to additional questions and discussion among most of the provisions in this bill. Particularly, and finally, we strongly support everything included in the bill that would address drug pricing and would ask you to actually go further. We also strongly support the elements that would require transparent reporting from pharmacy benefit managers to plan sponsors. The lack of transparency makes it impossible for most employers to even know prices, rebates, and other pricing complexities, much less negotiate lower prices. Thank you.
Ms. Mitchell, many states, including my